All right, now it's recording.
Okay.
Can you hear me? Yeah.
I can. Okay. All right. Let me get my paperwork real quick.
Sure.
Then I had to plug my computer in. So I'll be right back.
Okay.
Okay. So you're going to be the patient and I will be the clinician. Is that right?
Sounds good.
Okay. Okay. Right. You ready?
I'm ready.
Okay. Hi, my name is Jenny. I'm a student nurse midwife, and I will be I'll be talking to you today. What's your name?
My name's Anne.
Hi, Anne. What brought you in today?
It's like, oh, my stomach hurts.
Your stomach hurts. Okay. And we got a set of vitals before you came in. Okay.
Yeah.
Okay, so when did your stomach start hurting?
It began about 8 hours ago. It was kind of started as cramps, and then it got worse.
Okay. Where is it at on, is it just your stomach? Can you kind of tell me where it is and what kind of pain it is?
So at first it was in my my lower abdomen. I'm pointing.
Okay.
It as cramps, and it wasn't that bad then, about a 3. And then it got worse. It was like a 5. And then I started to throw up.
Okay, you started to throw up. So you said this started about 8 hours ago?
Yes.
And it's cramping. Did you take anything for it? Is there anything that makes it better or worse?
Let me think.
Okay.
No medications.
Okay. All right. And is it just in your stomach area or does it radiate anywhere else?
It's pretty much right in my stomach.
Okay. All right. Have you had any problems with your stomach before?
I had appendicitis when I was 10.
Okay. Have you had any acid reflux or any problems like that?
No, I haven't.
Okay.
No pain or nausea, bloating.
Okay.
Had a
Any Oh, go ahead.
Oh, I said I've had a pretty good appetite until I got sick.
Okay. Okay. Any history of problems with your pancreas, your gallbladder, liver, anything like that?
No.
Okay. Okay. Any history of bladder infections or kidney infections?
No.
Okay. All right. Have you had any surgeries?
Just I had an appendectomy when I had the appendicitis.
Okay. Okay. What medications are you on?
I just take a little over the counter when I have allergies. I take loratadine, but just during March and April.
Okay. Do you take any herbal medications or anything like that?
No, I don't.
Okay. Do you have any allergies that you know of?
No.
Have you ever had any history of stomach problems in your family?
Not that I know of.
Okay. Any history of cancer in your family? Cancer of the colon, stomach?
No.
Any history of liver disease in your family?
No.
Okay. Do you smoke?
I do not.
Okay. What about, do you drink any alcohol?
I have a little glass of wine after dinner 5 or 6 times a week.
Okay. Any drug use? Marijuana, street drugs, anything like that?
No.
Okay. Um, any unusual stressors in your life lately?
No.
Okay.
It's kind of same.
Same. Okay. What about your diet? Any recent change
It's
in
kind of
your
good.
diet?
I haven't eaten much uh,
Okay.
since I got sick.
Okay.
Um, yeah, I tried to eat some saltines and those everything came right back up. I tried some Powerade. It just every time I eat or drink something, it seems to feel worse.
Okay. And I noticed that in your vitals you had a fever. Do you have any idea when that started?
Well, I haven't checked my temperature at home.
Okay. That was so you didn't know you had a fever until you got to the office.
That's right.
Okay. I'm just going to ask some questions, maybe about some other symptoms to make sure we're not missing anything. Okay.
Okay.
Okay. You already told me kind of about your pain and your any difficulties swallowing?
No.
Okay. Any diarrhea or constipation?
Well, I had diarrhea when I got here today.
Okay.
And then, yeah, no, usually I have a bowel movement every day and it's pretty soft and formed.
Okay. But you had diarrhea when you got to the office today.
I did. Yeah.
Okay. Have you noticed any yellowing of your skin or that your eyes are yellow?
No, I haven't noticed that.
Okay. What about your urine? Does it look different, smell different?
My urine doesn't, but the vomit was green.
The vomit was green. Okay.
Yeah, greenish.
Okay. All right. And did you say you vomited twice?
I vomited about 6 or 8 times.
Oh, 6 or 8 times. Okay. And was it green every time? Did it
Uh,
ever change?
I think so. Yeah, yes.
Okay.
There's no blood though.
There's no blood that you could see?
Correct.
Okay. All right. I don't think I have any other questions for you. Um, we're going to put this all together and then help you feel better.
Okay. Thank you.
You're welcome. Thank you.
Sure.
Wow, that was intimidating.
Well, sorry, it was kind of like it's not written down how
Right.
someone would ask it. So I think you got everything though. I don't know if I'm supposed to tell you that, but.
Oh, okay. No, that's awesome. Yay. Okay, let me get my patient thing out.
Okay.
Okay.
So, hi, I'm Kathy. I'm a student midwife, and I'm going to just take a look at you today and see what's going on. What was your name?
My name is Rose.
Hi, Rose. How are you doing today? What brings you in?
My head hurts.
Your head hurts. Okay. Like a headache?
Yes, it's a bad headache.
Okay. Is this the first one like this you've ever had?
Yes, I don't usually have headaches.
Okay. How long has it been bothering you?
Um, it started suddenly about 6 hours ago.
Okay. Did anything happen at that time when it started? Like, did you bonk your head or wake up from a bad sleep, or were you having like vomiting or coughing or anything?
Um, Coughing makes it worse. And
Okay.
I vomited twice since it started.
Okay. So are you having a lot of nausea too?
No, not right now.
When you vomited, what did you lose all your food?
It doesn't say.
Okay. Was it like green or just liquid, or was it actually have some substance to it?
It must have been normal vomit.
Okay. Have you taken anything for it, like some Tylenol or ibuprofen?
I did. I took some Tylenol. I
Okay.
took 1,000 milligrams about 15 to 20 minutes after it started,
Okay.
and it didn't help.
It didn't help at all.
No.
Did you try anything else, like going into a dark room or laying down or cool cloth?
No, I didn't.
Is it just, where is that? Can you show me where on your head it hurts?
It feels like pressure from my temples across the top of my head, like my head is being squeezed by a vice.
Okay, on both sides.
It doesn't say.
Okay.
But squeezed like a vice, yeah.
Okay. And sorry, you said about 6 hours ago?
Yes.
Okay. I noticed on your vitals that your blood pressure was a little bit elevated. Do you know what your normal blood pressure is?
My last blood pressure at my annual exam 6 months ago was normal.
Okay. And has it always been normal as far as you know?
Yes.
Okay. All right. Is it feeling okay enough for you to answer some questions for me?
Sure.
Okay. So do you have any history of like dizziness or imbalance or epilepsy?
No.
Do you notice any weakness, numbness, tingling?
No.
Okay. And have you noticed any changes in like any of your senses? So vision, hearing, smell, taste?
Yes, actually, I saw flashes of light in both my eyes about 5 minutes before the headache started.
Okay.
And then I just remembered, because you asked me if I had problems with my blood pressure before.
Uh-huh.
I had my baby 8 years ago,
Okay.
and I had preeclampsia at that time, but my
Okay.
blood pressure returned to normal 3 months after she was born.
Okay. And when you had preeclampsia, did you ever notice that you had a headache kind of like this or no?
No.
Okay. What's your baby's name? I guess she's a big girl now.
She is. It's not written down, but my baby's name is Chloe.
Okay. All right. Do you take any medications, Rose?
I do. I take an ethinyl estradiol
Okay.
and a levonorgestrel extended cycle. I think it's also called Seasonal.
Okay.
And I take those daily. I've been taking them for the last 6 months.
Okay. Any pain in your legs at all?
No.
Any other herbal supplements that you do use?
Nope.
Okay. Do you smoke?
I do not.
Okay. Do you drink any alcohol?
No.
Okay. Do you use any street drugs or marijuana?
No.
Okay. How about any allergies?
No. Nope, no allergies that I know of.
Okay. Have you all before you had your baby, did you take other types of oral contraceptives?
No.
Okay. And then in your family, is there any history of stroke or epilepsy, anything like that?
No, my dad is alive. He's 70, and he has hypertension that he takes medicine for.
Okay.
My mom died from breast cancer when she was 60, and she did have migraine headaches that worsened after menopause for her.
Okay. Okay. Well, thank you for all the information, Rose. I think we're gonna, we're gonna think about this and maybe come up with a plan. Might have something to do with the medications. It might have something to do with your blood pressure. So we'll figure it out and make a plan.
Okay, sounds good. Thank you. Yeah, perfect. I think you got everything.
Okay.
Yeah, everything was on there. So
You don't know what's really going on, you know?
I know, right? Right. That is, and it's kind of hard when I can't make anything up either because I'm like,
Right.
no.
Okay.
Okay, so then I think at this point, I think when we close, because you did the call, you can send the link to me.
Okay. And then,
I think that's how it works.
Right. And then we send it to her name's escaping me, like the main professor.
Oh, is it Polly Aston?
Yes.
Yes.
Yeah. Okay. So I will try to do that when we hang up.
Okay. Well, thank you. I'm glad it worked out.
Yeah, me too. Is your child feeling better?
He is. It was my son, my youngest son, and he power puked in my bedroom the night before. That was always fun, but nobody else has gotten sick, so I don't know if it was something he ate or maybe just something that the rest of us have had before or something. I'm not sure. So
yeah. Well, fingers crossed.
I know. Hopefully, yes.
You have to do the paper this week too.
I did. I just turned it in on Friday.
Yeah. You
do. I'm kind of nervous. It wasn't my best work.
No, I just after a while, it is what it is, I guess. So
right. Yep. I just kind of turned it in. I didn't reach the word limit right away, and so I kept trying to decide. Do I need to bring in another concept or just try to add words to what I have? And we'll see how it turns out.
Yeah, at least there's an opportunity to make corrections, right?
Yes, thank goodness.
All right, well, get some sleep after your long day.
Okay, thank you.
Thanks.
Enjoy Montana.
Thanks. Wyoming.
Okay. Bye.
Bye.